Are layoffs appropriate for individuals who cannot work due to being high risk for serious illness and the employer is able to find appropriate alternate work? Good question. Um, uh, One of the things that you now have to take into account with the myriad of changes, and I'm assuming this would be a provincial employer and not a federal employer, therefore governed by the Provincial Employment Standards Act. Because as you may recall, if you've seen our recent newsletter, uh, the provincial government amended the Employment Standards Act in order to give job security for people who are absent because it's related to the pandemic. And it operates if you are on this leave of absence. It's like a maternity leave. All of the obligations about bringing them back, and comparable employment, and you can't discriminate, and reverse onus on you to say it had nothing to do with the pandemic or the leave. All of those principles apply, but they're a very limited group. Uh, for example, those that have been diagnosed with it and under the instructions. People that are in quarantine or self-isolation, but not self-quarantine because they decided to do it, but more, the provincial health officer has ordered them. Here's one that would likely apply in these circumstances, in my view, given the bona fides of the employee's concerns. The employer, due to the employer's concern about the employee's exposure to other, has directed the employee not to work. And I think that would apply in these circumstances. So um, uh, the person is laid off in the sense that they're not working, but they are, in my view, under a medical leave. So when you're doing the ROE, you fill out not A, shortage of work, but you put D, medical leave. And I think that's right. D, medical leave. So I think they're kind of in a different position than maybe other employees. So they're not technically laid off, but they're going to get all the EI benefits.